Welcome to the next video in the COVID-19 video series. My name is Leah Hampson-Yoke. I'm a PA in infectious disease at the Fred Hutch and the University of Washington. In this video, we will talk about testing for COVID-19. Many of you, particularly in cough and cold season, have patients who come into your office with runny nose, sore throat, and a cough. Many times we just say, oh, it's a viral infection, it will run its course. But in current times, we now have testing, particularly for the big three, COVID, RSV, and influenza, that allow us to both test and also provide specific treatments for these viral infections. This is important because these viral infections can cause severe disease. And when we're thinking about COVID-19 specifically, we're thinking about patients that can develop severe disease and/or death from COVID-19. These are the patients that we really want to make sure that we are testing and thinking about treatment in. Testing is really important for COVID-19 for a number of reasons. First, it really helps our patients understand risk. Risk of other people in their family or friend group that could be at risk for severe COVID. This might inform them in terms of masking or social distancing. It also helps with our public health awareness of understanding COVID-19 and implications in times of viral surges in our population. It's especially important in our high-risk patient populations where a conversation about treatment needs to happen in order to ensure that they do not develop severe COVID and/or death. As we'll talk about shortly, it also helps us understand post-COVID conditions, which can be very difficult to diagnose. So when we're thinking about testing, it's really easy to think about patients in your clinic that need to be tested. They have a runny nose, sore throat, and you test them for COVID. What's more difficult to think about testing is understanding post-COVID and who to test for post-COVID. Symptoms are really broad for post-COVID on the understanding that COVID can infect in its initial period many different organs. Thus, post-COVID conditions can cause significant issues with heart, lung, kidney, can cause rheumatologic diseases, muscle aches and pains, and it can also cause chronic fatigue. We also know that COVID-19 can exacerbate comorbidities in patients that already have some pre-existing conditions, and this can also cause post-COVID conditions. The way that we diagnose post-COVID is really based on patient history. It's sort of what they're telling you in the room, and we base our diagnosis off of that. So it can really look different depending on the patient presentation. Labs might be important. It might be important to get an EKG if someone comes in with cardiac complaints after a history of COVID. It might be important to get pulmonary function tests if they're having respiratory complaints. Other things include rheumatologic testing if they're having joints or muscle aches and pains. It can be very challenging to sort of diagnose this given the variety of symptoms. Because these patients can often present with many different types of symptoms, a multifaceted approach is really important. In some large cities, multidisciplinary clinics for post-COVID conditions are available. These clinics really think about patients holistically and can be really valuable. However, I also recognize that these are not available everywhere in the United States. When we think about post-COVID conditions, there's really some specific patient populations that may be more at risk. These are patients that includes those who have experienced severe COVID, patients that have had that multi-system inflammatory condition, those who are not vaccinated, and those who are greater than 50. These are patients that really are at high risk for post-COVID condition, and you should be thinking about that in your differential when they come into your clinic after their index COVID infection. As I said, one of the most important things that we can think about with COVID is understanding testing to inform our treatment. In the next video, we'll talk about treatment options and ways that we can think through how to treat high-risk individuals with COVID-19.